Nurse Cunningham?
Yes.
Hey, I'm Cedric Swinson. Dr. Sandy sent me over.
Nice to meet you, Mr. Swinson. Have a seat.
Okay,
Take
here you
that.
go. Yeah. Dr. Sandy sent me over, told me I can sit and talk with you, learn a little bit more about depression.
Oh, certainly. Well, let's just dive right in. So, depression is a medical illness that affects how a person feels, thinks, and acts. It's caused by chemical changes in or natural changes in your chemicals in your brain. Now, most experts actually believe a combination of family history, which is a person's genes, this is what you get from your mom and your dad, or inherit from your mom and dad, and stressful life events can actually cause depression. It affects men and women of all ages and backgrounds, believe it or not.
Wow, depression sounds like a chemical imbalance. Now, how would I feel if I was depressed?
Great question. What you're asking me is what symptoms would you have if you're experiencing depression? You may have less energy. You may feel grouchy or irritable for a long period of time, longer than normal or more than normal. You may eat or sleep more or less than usual. You can have feelings of guilt or unworthiness. You may find it hard to focus or remember things or even make decisions.
Wait, I just thought that was just kind of, when you're kind of feeling off, I just thought that was just something in life, like not really depression. But...
Well, that's somewhat true. Symptoms of depression may be hard to notice at first. They vary among people, and it's easy to confuse them with just that, feeling off. We do have ways to measure the symptoms of depression against whether, or to figure out whether they are just those everyday life things you're talking about or actually depression. Now, the two most common symptoms are feeling sad or hopeless nearly every day for at least 2 weeks, losing interest in or not getting pleasure from most activities that used to be enjoyable to you, and feeling this way nearly every day for at least 2 weeks. Now, a serious symptom that comes with depression is suicidal thoughts, thoughts of hurting yourself or being so hopeless that you just want to end it all.
So now, Dr. Sandy mentioned some type of depression screening. What does that look like for me? I already answered that questionnaire I gave you.
Yeah, the questionnaire that you answered is a patient health questionnaire. It's actually a PHQ-9.
Okay.
Now, this measures some things or feelings and behaviors over the last 2 weeks.
Okay.
This is one tool that we use if, in your case, you mentioned some triggers to Dr. Sandy when you told her about the death of your best friend and even your recent breakup.
Oh man, that's really hard to talk about. I didn't think she would tell you that. Oh God.
Yeah, sorry about that. So again, this questionnaire is, just a screening tool that we use when we hear you speak about those triggers. Now, we also drew your labs today.
Oh, now, whoa. Now, that's confusing. How does you see depression in my blood?
Well, we look at your blood actually to rule out other medical conditions that may be causing your symptoms of depression. We'll look at your thyroid function. Hypo or low thyroid function is actually the most common medical condition associated with depression symptoms. We will look at your thyroid function to make sure it's not hyper or high in its function. You could have Cushing's disease if that's the case. We want to look at your blood to make sure there's no anemia. We're going to pay close attention to your vitamin D levels, your calcium levels. Any deficiencies in any of those things could mimic depression. You can have those symptoms. Now, if there is no other medical reason found for your depression once we get your lab work back tomorrow, then we will certainly meet with you, and Dr. Sandy will look at some other treatments that are specific to depression.
Now, what's available to treat or manage the depression you're talking about?
Well, let me first give you this handout. I'll say that in many cases, counseling can work as well as medications to treat mild to moderate depression. Now, counseling is done by licensed mental health providers such as psychologists, social workers, and some types of nurses. It can be done in one-on-one sessions or in a group setting. Many people find group sessions helpful. Cognitive behavioral therapy is a type of counseling. In this therapy, you learn how to see and change unhelpful thinking styles that actually may be adding to your depression. Counseling and medications often work well when they're used together. So, what I've handed you here is information about antidepressant medications. Now, that will show you different kinds with their names. It shows you side effects of those medications. It shows you how they work to help and treat your depression as well. So antidepressant medications, they can improve or end the symptoms of depression. You may need to take the medication for at least 6 months and often longer. Now, if you're placed on the antidepressants, you want to make sure you keep taking your medications even if you feel better. If you stop taking it too soon, your symptoms may come back or get worse. You may start to feel better within 1 to 3 weeks of taking antidepressant medication, but it can take as many as 6 to 8 weeks to see more improvement. Talk to Dr. Sandy if you have problems with your medication or if for some reason you notice that there is no improvement after 3 weeks. So moving a little bit further down the road, there's another treatment called transcranial magnetic stimulation, TMS. Now, if for some reason that a patient is having adverse side effects to the antidepressants or nothing that we're trying is working and is making them feel better, that would be the route that we would take. And I also gave you a handout letting you know what TMS is, how we do it, and what you can expect from that treatment.
Well, I'm looking at some of these side effects, and if that's going to bypass a lot of the stuff I'm looking at, my sexual problems, weight gain, headaches, I need for everything on me to work. So the sexual problems might be.
I certainly understand, Mr. Swinson, and let's just stop here and say we'll get your blood work back tomorrow, and we'll just handle that, and we'll talk about that a little bit further if it comes to that. Okay.
Okay.
Now, I will also tell you about managing. You asked me about managing and the treatment. So, just day-to-day things. Be physically active. Getting 30 minutes of exercise each day is good for your body and for your mind. If you're not already exercising, begin slowly and just try to incorporate activities that you enjoy. You need to get enough sleep and eat a balanced diet. If you don't feel hungry, eat small snacks rather than large meals. We don't want you to drink alcohol, use illegal drugs, or take medicines that your doctor has not prescribed.
No alcohol. What about weed?
Okay, well, let's first start with alcohol. Do you drink alcohol?
I definitely drink alcohol.
How often?
Maybe 3 or 4 times a week.
Okay, wine or liquor?
Both.
Okay, well, I will say that alcohol does cause some unwanted side effects with the antidepressant medication. So if we get to that point and you're taking those, we want you to just start slowly. Go from 3 to 4 times a week to 1 to 2 times a week until you are not drinking any alcohol. What about illegal? Well, you mentioned marijuana. Do you smoke marijuana?
Oh, I definitely smoke marijuana.
Okay. Well, I will say that marijuana does cause some depressive symptoms. So there is CBD oil now that we can prescribe, and it gives you those same effects as far as the relaxation, decreasing the anxiety, and that's just a legal version of the marijuana, just without some of those harmful chemicals. What about any other prescription medications? Do you take any of those?
No.
Okay, great. And I asked you that because some other prescription medications could have some interactions with antidepressants as well.
Okay.
So, just a few more things. You want to make sure that you're not making any major life decisions while you're depressed. Depression may change the way you think. You will be able to make better decisions after you feel better, though. And we want you to think positively. Challenge negative thoughts with statements such as, I am hopeful, things will get better, and I can ask for help when and if I need it. Write those things down and just say those and affirm those things to yourself every day. And Mr. Swinson, please be patient with yourself. It took time for your depression to develop, and it will take time for your symptoms to improve. Just don't take on too much or be too hard on yourself. Learn all you can about depression. I've given you some written material. Check out behavioral health classes to learn more about dealing with depression. And one other very, very important thing. We talked about having suicidal thoughts when you have depression. If for some reason you're alone, you don't feel like you have someone you can turn to, if you start having those thoughts of harming yourself or ending your life, I'm going to give you a phone number. This is for the National Suicide Hotline, and that number is 1-800-273-8255. And again, that's someone you can reach out to that can, just speak with you to start having those thoughts.
Now, is there another number? Like, can I call you? Can I?
Well, before we go there, let's talk about follow-up. So if in fact we get your blood results back and there is nothing else going on, we rule out all the other medical conditions, and we start you on the antidepressant medications, it is very, very important that you follow up.
Okay.
You want to make sure you keep your follow-up appointments because we need to gauge whether those medications are helping you and make sure you're not having any of those unwanted or adverse side effects. Okay? Now, any other questions for me?
So you guys will call me, tomorrow?
Yes.
Couple days?
We're going to get those blood results back tomorrow, and we'll give you a call at that time to kind of move forward and tell you what the plan is. Okay?
Okay. Miss Nurse Cunningham.
Yes.
Yes. Looking forward to hearing from you.
Okay. Well, we'll give you a call tomorrow. Very nice meeting you, Mr. Swinson.
Thank you.
Okay. Hello, I am Toshia Cunningham Swinson. This is Nurse 221, and this is my teaching learning project. And I hope you enjoyed, and I hope you learned about depression and those side effects, those symptoms, and just any other information that you may need to know about that. Good day.